All right. Hey, you guys, I'm excited about what I'm going to present today. This is the Longevity Fitness Movement Enhancement Technique Series, MET for short. We're still focusing on the glenohumeral joint. So last video was glenohumeral joint part 1, which focused basically on 4 muscles, the 4 rotator cuff muscles. So sits, supraspinatus, infraspinatus or natus, teres minor, and then subscapularis. Okay, I showed you how to work on those, right? If you haven't watched that video, watch that one first and come back and watch this one. All right, so next we're going to work on the glenohumeral joint part 2. So there's other muscles that can affect the joint that wouldn't necessarily be considered, some may disagree with this, shoulder muscles, but they are. And I'm actually going to have to annotate this because I forgot one muscle, but I'll include it in the video now. All right, so these are muscles that cross this glenohumeral joint here, and they attach elsewhere on the body. Either attach to the scapula, or they attach somewhere, probably most likely on the rib cage or sternum. Okay, so first one, pectoralis major, attaches to the sternum, comes across, attaches to the humerus. Okay, latissimus dorsi, that muscle right there, attaches to the humerus and goes down, fascially blends into the, and it's a cross pattern into the right glute if we're talking about the left side. Okay, then teres major, scapula to the humerus, and biceps brachii, so the guns, right? So biceps brachii attaches here, goes up, attaches to the scapula. All right, triceps brachii, the long head, this guy on the inside here, back side of the arm, but more medial, attaches humerus and scapula. And then coracobrachialis, which is another humerus and scapula origin insertion arrangement. Okay, so we're going to work on those, and they can all affect range of motion of the glenohumeral joint. Okay, whether it's internal rotation, external rotation, flexion, abduction, horizontal abduction. Okay, so all those movements can be affected. Now, the other thing, we'll go into part 3 and we'll start talking about the scapulothoracic joint, which is the shoulder blade. Okay, that's coming up next. All right, so pec major, real easy. Take a ball, roll it out. You can just simply do it this way. Sometimes I grab the ball and I will actually, so I'm actually, that's just not the shirt, but my skin, fascia, and muscle is actually moving under the pressure of the ball. I'm moving that pec up and down. I know that looks funny, but I'm gonna work all over. A little bit harder for you ladies, but you can still do this good work. I like kind of doing fascia work that way, and then also we can do the MFT fingers and move that tissue. So I'll go all the way up into the humerus, just kind of trace the muscle up into its insertion. Okay, one thing I didn't talk about was the deltoid. That muscle you got middle delt, anterior delt, posterior delt. Definitely got to work on those if you got shoulder pain or range of motion issues. Okay, and that one I'll just go up against the wall. My hand represents the wall, and roll that, roll anterior. Then I can also get some pec here, pec, anterior deltoid, and then posterior deltoid. Okay, I know it's hard to see, but I'll just have my arm against the side, roll that deltoid, I'll come up, hold my hand, roll posterior deltoid, and then this would be anterior deltoid. All right, so that's the anterior. Next, okay, is the lat. This was a little bit harder to work on. So when you do your foam rolling and you roll the muscles along the spine, that's going to get the lat too. But then if we're going to get a little more detailed about it, then I want to come in and work on the lat, and then add its insertion on the humerus. Well, not really, it's kind of comes around, but we'll get some of it. So lat, and I can even actually work the muscle along the spine here. As you can see, I'll hold the ball there, and if I go all along that, I'm going to work on that. I'm going to get some of that lat as well, because the lat's the most superficial muscle. It's the outermost. Okay. So the other way to work on the lat is with the foam roller. I'll grab one real quick, and you can do it this way. And I like this one a lot. This works really good as well. And I'll get in sideline position, and I can just kind of work the lat here a little lower. I'm resting on my rib cage is getting pretty tender, so be ready to hang out, breathe, try to watch your posture. You can also add active movement. So go overhead, right? Stay out of pain. You can horizontally adduct, or horizontal adduction. This is abduction, that's adduction. So while I'm here, which is kind of cool, I'm not going to talk about it because it's going to fall over the next one. I shouldn't go there. I'm just going to go right into the lateral border of my scapula, and I'm going to hit rear deltoid, teres major, teres minor, latissimus dorsi. So everything right there in that little area, and I can get in here, do some just static compression, do some movement. You can even also press into the ground to contract the muscles. Then inhale, exhale, and move. So really good release work here. And then I will also do internal, external rotation as well. Okay, so that's lat and a whole bunch of other stuff, but we're focusing on the lat there. Teres major, I just showed you that. That's combined with the lat work for the most part. Biceps brachii, that one, it works best if you're going to roll against the wall with the larger ball. It just gives you space between your body and the wall. So again, I would, if my hand represents the wall, I'm just going to roll that biceps out. I can also, like I talked about, doing some myofascial work where I'm actually moving the tissue. You can see this is some cross fiber work. Awesome. This is great stuff. All right. I can do longitudinal release, or going with the fibers. This is across the fibers. There's specific techniques that I use as a therapist. Okay, and while I'm there, you can get in. It's kind of underneath the pec and underneath the bicep. There's the coracobrachialis. It's right there, and that could be pretty tender too. So a lot of times I'll just take my hand, do some MFT fingers on it, glide the tissue, or you can get the ball in there and roll it out. Either or. Okay, so that's the coracobrachialis. Okay, and then last but not least is the long head of the tricep. That's this guy right here, and it attaches at the olecranon to the scapula. There's somewhere's over here, I believe. Yeah, I can feel the insertion right there on the scapula. So anyway, that one I'll put my hand on the desk. So if my hand is or the ball on the desk, and then work it this way. So So if my hand is the desk, I can do that. And I can also do it up against the wall. And I'm just going to support with this hand and work on that tricep. And again, you're going to kind of work in that same area where the teres minor is, teres major, lat insertion, rear deltoid, and the infraspinatus and teres minor, all in the same spot. Okay, so that is part 2 of the glenohumeral joint. All these muscles cross the joint and attach either to the scapula or the humerus itself. All right. Work on this if you have some shoulder stuff. This will it'll pay big dividends for you. These are good things to work on. Shoulder's pretty complex, so I got a part 3 coming, and it's talking about the scapulothoracic joint, which is that shoulder blade. All right, you guys, have an awesome week. Take care.